Hi, I'm Robert Lauritsen. I'm the CEO and co-founder of Cerebriu. Thanks for taking 5 minutes of your time today here at the TEXGHS to listen about our company and what we're hoping to do for healthcare, transforming radiology. So let's start about the problem. What problem are we looking to address at Cerebriu? Well, we're looking to address strokes, the second largest killer at all times. In the US alone, 800,000 people die per year. And it costs a society a total of $46 billion per year. Now, there are two factors that are really important that we want to address here. One is the fact that time is brain. So the faster we can get people into treatment, the less disability and the less likely mortality is. And the other part is that during COVID, we've all experienced that hospitalization is a major issue and hospital systems are buckling down for this, that we can somehow address hospitalization for all the patients that are not stroke patients. Now at Cerebriu, we are looking to automate MRI for stroke examinations. And why do we want to do that? We don't do that for faster, confident patient selection during stroke treatment. So if we detect a stroke, we can ensure that we can adapt the imaging protocol real-time of the patients in the scanner to acquire the relevant and necessary imaging target for differential diagnosis of that stroke and get a fast treatment decision within 10 minutes of starting that examination. On the other hand, if we can exclude the stroke, if we can rule out that stroke, we want to avoid stroke treatment, unnecessary stroke treatment, and we want to reduce the length of stay in the hospital to free up capacity for other patients. So let's talk about the team behind this company. Besides myself, as CEO and co-founder, with 25 years of experience in developing business, we have a CTO, Akshay Pai, veteran machine learning expert within medical imaging. We have a practicing neuroradiologist as a chief medical officer, Dr. Amin Korchi from Switzerland. We have a professor in machine learning and medical imaging, Mads Nielsen, running science, and Martin Lindholm heading our regulatory and quality. And finally, Matthew Liptrot as the clinical operations director, managing our clinical trials. Now, looking at what kind of market we're seeing out there, in the US alone, there are 12,000 MRI units and growing about 10% per year. In the US, there are performed about 10 million brain scans and MRI. So there's a lot of activity going on in that space. Obviously, the CT is still predominant in early stroke detection, but typically patients end up in the MRI anyway, and some centers are moving towards MRI first examinations. If we look at the size of this market from a worldwide perspective, we anticipate an estimated total addressable market of $1 billion. It's an early market. Budgets are still being established from business cases, etc., but the value is out there, and we believe that we can tap into it, and that we over the next 6 years should be able to take about 5% of that market, or equivalent to $50 million in revenue. If we look at where we are now, we have established partnerships with validation partners across 3 continents. In the US, we're early started. We are executing our first retrospective study at upstate New York. We are just initiated in the UK as well, and have long-term partners with our local hospitals in our surrounding neighborhood of Denmark and Norway, and are starting up in Germany and Israel, and just completed our first prospective study in India as well. If we're looking at where we're going with these partners and with more, it is not just starting with stroke, it's actually looking at automating brain MRI fully to enable the technologists to perform routine brain examinations without the hard need of a radiologist at their side, unless we detect pathology for them to complete the differential diagnosis. And finally, if we're looking at what help we're looking for right now, we are looking for 2 things, namely support on these clinical trials in the US with our US partners already established, but also we're hoping to see a TMC-based institution of that system in our ranks, and helping us with funding for those trials over the next couple of years. We're also looking for go-to-market support by you guys here around South by Southwest for access to the first TMC comprehensive stroke center that is looking to or performing MRI first-based stroke care. I'd like to thank you for this opportunity. I hope you enjoyed my short pitch and encourage you to reach out and hear more. Have a great day and a great event. Bye.